was hardly 11 years old. My brother started his wholesale shop, and my father forced me rather out of my childhood that don't go for playing games. Go and sit and assist your brother in his shop. In the domestic market, there were different challenges because there were no new products coming up. I think no new research molecule coming up. Nothing new was there. So for one product, there were almost 500 to 600 brands competing with each other. So my point is challenges will be there. What I feel I'm here is because of passion. So now with passion, vision and professional approach will make you ready to take up any challenges.
True.
Add something networking into it. Networking is very key. Again, right network and you are through.
So, welcome to today's podcast. We have Mr. Sandeep Modi with us. He is a founder and director of Infugen Pharma, and along with that, he is a vice president at FPME. And today, we are going to dive deep into his journey, how he has started, and how he has become an entrepreneur. So, welcome to you, sir, on this podcast.
Pleasure.
So, sir, Sandeep, sir, when we see like in industry or any college students who are coming up in the industry, majorly they think of stable career. They want to have corporate job, right? But you have chosen path of entrepreneur, right? We would like to know more about how you made this choice and how the journey has begun.
There's an interesting story. My entrepreneurship journey started when I was in 7th standard. I was hardly 11 years old.
Okay.
My brother started his wholesale shop, and my father forced me rather out of my childhood that don't go for playing games. Go and sit and assist your brother in his shop. So a small wholesale shop started at 180 square feet area in Sangli, Western Maharashtra. So I was studying as well as I was also going into my brother's shop and looking towards reading all the medicines, right? I wanted to become an engineer, 1990s kid. Everyone wanted to be an engineer, but certain things changed the scenario and I ended up doing commerce. My father always wanted me to do commerce.
Yeah.
So I completed my commerce background. Still doing commerce, I was also assisting my brother in his business and everything. And as soon as my commerce graduation completed, my brother handed over me keys of new branch in Miraj, which is a medical city of Western Maharashtra. So I had an opportunity to work in Miraj with multinational companies like GlaxoSmithKline, AstraZeneca, Sanofi, Pfizer. Then USV was one of I was stockist for. Wokhard I was stockist for. So my first entrepreneurship job, I can say that serious entrepreneurship started in 1996 with Sri Krishna Distributor as my firm, where in Miraj, where I, set up a distributor network for my Miraj. Miraj is a very, every gully who can cook, you will find one hospital. So it has very good potential.
Yeah.
It also gave me an opportunity to learn me the selling skills there.
Okay.
So actually I was supposed to do MBA.
Yeah.
24th May 1996, we had a puja of opening of Sri Krishna Life Distributors. And 26th May, I gave an entrance exam for MBA.
Okay.
I cracked it, everything. So I was doing MBA also. I was handling distributorship also. In the second year, my college said that we cannot graduate you to the second year because your attendance is not there. So one of my mentor told me that, Sandeep, there was a question whether I should continue with my studies or whether I take up my entrepreneurship. My mentor, he told me that, Sandeep, what you want to do after completing MBA? I said that I want to be into international market of manufacturing of pharma and everything since we are in distribution. So do you have funds for it?
Yeah.
I said, I have not thought about it. Get money, get profit out of it. This is very good business. Okay, business will teach you more than
True.
management colleges
Yeah.
institutes. So that struck me, and then I continued my journey. So till 2003, we were having our own distribution network and everything. My elder brother was very fond of having our own marketing network.
Right.
Since we were into distribution, he was having a vision of having own own products,
Yes.
own marketing team. And in 2000, year 2000, he came across one company called Cipra Remedies, for where he got an opportunity to market small volume parenterals, that's liquid injections,
Yes.
100 ml injections, because he had a good network with his own network. He wanted to get the leverage. He was also president with Sangli District Chemist and Druggist
Yeah.
Association and other things. So his activities, his network was very helpful for me during my entrepreneurship growth. And then when we had our own marketing network, then he said me that, Sandeep, we are very much leveraged. We are dependent on Cipra remedies. We should come up with different range of products with our own branding.
Yeah.
So in 2004, we came up with our own team. We have our own products. Like we came up with the critical care products like Safe Triaxone, Cefotaxime. Then we made a team, small team in Western Maharashtra,
Okay.
that was doing well, but growth was a challenge. Pharma scenario was changing from 2004-5. There was lot of changes coming up with the new excise policy. The manufacturing base was shifting from Maharashtra, Gujarat
Yeah.
to north towards Baddi. The costing and everything was open. There was lot of capacity was being built at Baddi. So again, there were a lot of people, they were coming into the marketing scenario.
Right.
As well as in the domestic market, there were different challenges because there were no new products coming up. I think no new research molecule coming up.
Yeah.
Nothing new was there. So for one product, there were almost 500 to 600 brands competing with each other.
Correct.
So we brainstormed, me and my brother together, we brainstormed that let's explore into the international market.
Yeah.
And in 2007, 2008, I shifted from Sangli to Mumbai to
Okay.
explore into international market. And then we started into international market. So 2003, when we started marketing, we started that under the name of Infugen Pharma Private Limited.
Right.
And then in 2008, we started into international market. So in international market, we have our presence in more than 15 countries.
Wow.
Where our products, more than 115 products, are registered in different countries.
Right.
Our main market is East Africa with Uganda, Tanzania, Mozambique, Zambia, Lesotho,
Correct.
Djibouti.
Yeah.
You can cover all the East African country except Kenya. We don't have our presence, but then East Africa is our major market.
Yeah.
We also have a presence in CIS country with Tajikistan. We have one of our, you can say, subsidiary company, which was earlier a distribution firm in Sangli, which we shifted to Mumbai, called Sri Krishna Life Care,
Okay.
where we serve the needy patients of the cancer
Yeah.
medicine at very
Right.
economical price. So Caribbean is the area where we work, the Caribbean
Right,
countries.
right.
So that's the geography you're looking at. My brother and his son is now in business now.
Okay.
So he is looking into the Southeast Asia with
Yeah.
Myanmar, Cambodia,
Right.
Vietnam,
Right.
Philippines.
Right.
Sri Lanka was one of my first market. We are doing there to the supplies to the government, but focus area is East Africa.
Okay.
Yeah.
I think that's very amazing journey, I would say, sir. Because you mentioned from seventh standard you started off, with business, and your journey have progressed, and you have become an entrepreneur, and now operating in multiple countries and being distributor. I think you must be having a lot of different experiences when you work with different countries, and when you supply over there. So coming back to the entrepreneurship journey, you mentioned that your mentor has suggested that if you are going to have your own business of course there'll be multiple challenges and you are going to get a lot of learning from there. So sir, anybody from the industry who wants to become an entrepreneur, right, what do you think that which are the key challenges that they are going to face and they have to be prepared for it?
See, basically, it's a mindset,
Okay.
right? Now, if someone wants to come into international pharma market, uh, earlier there was less regulation, but now there are more regulatory challenges.
Yeah.
See, regulatory challenges and internal challenges are the most. I mean, internal regulatory challenges or internal, systems where, still as a MSME entrepreneur, you're fighting with small issues with the government.
Yeah.
That is the major challenge right now. Otherwise, see, external challenges we can handle,
Correct.
right? If we are prepared, see what has happened, technical knowledge is very much important. I'm from a commerce background. Imagine I was in 11th standard, I was in science, having my 11th science. Some circumstances made me to shift to commerce, right? My accident had my hand plastered,
Yeah.
and then I was not able to crack the 11th standard science, and then I want to shift, but nobody guided me that you can BPharm is the one of the
Yeah.
segment. I mean, pharma is one of the big thing which you can look into it, you can get a career guidance into it. But ultimately I made it in commerce and came into pharma only. So my point is, challenges will be there. Only what is required today, what I feel I'm here is because of passion. So I can say till 2010-11, when I was in Sangli, I was in from the I can say Grameen area of India and kind of thing, rural area of India. Passion was the initial drive. So now with passion, if there is a vision,
Yeah.
passion, vision, and professional approach will make you ready to take up any challenges.
True.
Add something networking into it, and you are through. So challenges will be there. You should be, ready for whatever challenges you. And regulatory challenges are there, financial challenges are there, personal challenges are there, right? You should be ready for it. Only if you are having passion, vision,
Yeah.
professional approach, and right network.
Right. Right. Interesting. I think passion is something which keeps you driving.
Yeah,
On the
absolutely.
day-to-day basis, you should be stick to the why, like why you have started this journey and where you want to reach, and that's how your career progress, I believe.
So, in my childhood days, I used to come to Johnson and Mulund, where I stay right now.
Yeah.
But I used to visit Mulund because of my auntie was living there, and we used to see the factory of Johnson and Johnson. So that was somewhere in my mind. Yeah, see, this is the factory. One should be work with such factories.
Correct.
And now, when we work with multiple manufacturing partners, I'm really grateful that we get very good partners in that. My vendors and all the things, really, they are not like big like in Johnson and Johnson, but quality wise and every wise they are doing that. So something which you see in the childhood, when you see that that's getting realized,
Yeah.
that gives a different pleasure.
Right, right, right. And I think you are already, living your dreams when you are working with
Absolutely.
like all these clients and like, big brands.
Absolutely. See, going into international market and meeting different people, I mean, that's the biggest thing which I learned from, and
True.
that's the gain which I got from my profession, or you can say my entrepreneurship. What I learned that everywhere the personal, I mean, human behavior remains same.
True.
There is not much difference. Human connect is the which it matters. You have to look everything with the human angle.
Yeah.
Whatever technology, AI, or anything comes, if you add a human touch to it, you will be there.
Absolutely, sir. Sir, and you was mentioning in 2007-8, like you have started, exploring the international market, and like with the start of Infugen Pharma, it's been like almost 2 decades journey, right? Where you are operating in various markets. Like in your introduction, also you have mentioned a lot of countries. So the distributor who are looking forward to grow in different countries, and they are operating currently domestically or maybe one or two international markets, but if they want to step into the new international market, how you'll guide them, like how they can step into the new markets?
So basically, my thinking is, or my principle is, network is greater than net worth.
Yeah.
Right? I mean, this is not my line.
Right.
It is, I mean, I don't recall the name of the person. He's a great person there, but then that's the fact which you have
Yes.
to implement. So any budding entrepreneur who wants to be in the international market should connect with the right network. There are multiple networks available, just like we have FPME, our Federation of Pharma and Allied Product Merchant Exporters.
Yeah.
Pharmexil is one of the Pharma Export Promotion Council, and FIO, that's Federation of Indian Exporters Organization. I
Right.
am also on the committee of FIO for their GST and customs. But all those platforms will give you an opportunity to connect.
Yes.
It's up to you how do you crack it.
True.
Don't expect that platform you will give you a platter and see that these are the customers and you cater them.
Yeah.
They will give you requirements and everything, but then whether it is right connect or not, right, whether the payment terms and everything is correct or not, until unless you don't visit multiple forums, multiple
Yeah.
people, multiple countries, nowadays it is very difficult. People use now social media connect, right? Pharma, up to certain extent, it can be promoted digitally. There are certain limitations for pharma business to
Correct.
promote digitally,
Yeah.
right? So instead of, I mean, you should have your presence on digital and social platform, no doubt about it, but personal and physical visits is must for pharma, because you are dealing with patients, you are dealing with hospitals, and you are dealing with medicines. Just now I said that it is not a luxury, you are serving the need.
Yes.
So you need to understand what are the requirements and how do you then cater that people. Then you can strategize about it.
Right.
So one thing I can add, that with passion, right, vision, profession, network, the most fifth important part is strategy. Once you have every four things needed, strategy is very important. Strategic thinking is very important. So when I started my journey, I started as an opportunistic,
Yes.
right? But then opportunistic entrepreneur will end up only catering opportunistic things.
Correct.
Somewhere down the line, you need to think about strategic business, developing strategic business, and that's where one should excel.
Yes.
One should think about it. So one should think strategically and implement that strategy, right?
I think that's very important part, sir. Like when we talk about strategy, is of course, if you are planning for like 2 years or 5 years down the lane, strategy is something which keeps you motivated, and you have to change in between. It's not like for 2 years you'll be having one plan and you'll be implementing that.
Yeah. So for me, it is very learning thing. I think I had a strategy in my mind, but it was
Yeah.
not on paper. So one of my mentor, I'm a part of Ascent Foundation also, which is
Okay.
Harsh Mariwala initiative, and we have a trust group. So there are more than 700 trust groups of Ascent Foundation, and Harsh Mariwala, when I read his book, Harsh Realities, so inspiring from them, from his book, I joined that group, and then in one of that session, I came across one HR guy, because I was thinking that there are more challenges. I don't have team, and then I don't have system processes. I want someone who can put on systems and processes. So I hired that person. And when I hired that person, before he joining on getting me onboarded with me, he asked me one question: Sandeep, what is your business strategy? I was blank.
Yeah.
I have in my mind. Have you written down it in paper? No. Okay, I will give you a guide for having a business strategy. Make your business strategy first, and then I will make an HR related policies and HR related strategy. Until unless there is no business strategy, how I can hire a person for you who is aligned with your strategy?
Yes.
So strategic thinking as well as putting it on paper. Now, when I put it on paper, the guide gave me different angles, right? So that different angles that made me think that suppose today as a merchant exporter, I am dependent on some of the market where now, so I lost one of my product because not because of the reason. I had a very good sales in Uganda for one product called Tramadol.
Okay.
Now that product someone launched locally. Now, how do I do that? How do I de-risk that? Because local manufacturing is someone each and every country is advocating. How do I solve that? I said, let me think, make a strategy on it. Then we came of strategy of tech transfer, right? Tying up of that manufacturers locally, so that de-risking happens, right? So when you put on strategy, you have to think on 360 degrees. You have to do SWOT of everything, like SWOT of markets which you cater, SWOT of your own business, right? SWOT of product segment which you are working,
Yes.
right? And based on that, once your strategy statement is ready, so as I discussed with you earlier, Dr. Radhakrishna Pillai from the Chanakya, the famous author of Chanakya
Yes.
series, when I made my strategy presentation, he is my mentor also and very close friend. His office is next to me. So I called him, sir, I want to just see you this strategy. So he didn't knew anything much about pharma, but he just came and read and understood in 15 minutes. So he got one word from me. When we had made that SRA countries, because we were not working in SRA countries, that is stringent regulatory authority. ये SRA क्या होता है? सर stringent regulatory authority मतलब क्या कि बड़ी बड़ी कंट्रीज जो होती है जैसे कि यूएसए या यूरोप है तो उसमें हम लोग नहीं जा रहे हैं. और कौन सी कंट्री है? मैं बोला मिडल ईस्ट में कुछ कंट्रीज है, ऑस्ट्रेलिया है, न्यूजीलैंड है, जापान है, ब्राज़ील है. Why don't you target one country, Sandeep? Just write it on it.
Yeah.
And believe me, I made it right on it. And then certain things happened that now I am planning to enter into UAE market soon. So, thing is that having right network, like I had a right network of Ascent Foundation, which gave me an HR consultant who is helping me to build my team, right? Like having a mentor like Radhakrishna Pillai, and they all, they doesn't cost you more, once you have a personal touch and everything. People go behind the corporate thinking or corporate consultants. Believe me, I have lost huge money paying corporate consultants, delivering zero. Consultants come, they give you consultancy, but they will not deliver results. Because ultimately the responsibility of delivery is yours.
True.
Right? If you are failure, they will say that I had given you guidance, you have not acted. Whereas these people where you are found in right network, they do hand holding. Right? Shalil Nair, my HR consultant, is hand holding me.
Right.
Right? He comes with the background of Hewlett Packard, working in a Hewlett Packard, Reliance. Now you understand the importance of networking with Ascent Foundation, right? That gave me the opportunity to connect with the person who has worked with Reliance.
Yeah.
And Dr. Radhakrishna Pillai. With the FPME, I'm now entering into the different segment with Federation of Pharma and Allied Product Merchant Exporters. That is giving a larger network. So networking is very key. Again, right network.
True.
Right? So don't fall to any budding entrepreneurs. There are many consultants. Don't fall prey to the consultants who just come and give consultancy. Make sure that they handhold you and deliver.
Yes.
Get the deliverables also from the consultant. Ultimately, it's you who are going to work. Right? So Shalil had given me the guide to make the strategy. Right? Once I completed strategy, then he said, now let's work. So that's very important. Ultimately, you have to only work it. Consultant will give you, but then delivery is in your hand. Hand-holding, mentorship is very much necessary for the budding entrepreneurs.
I think that's very important giveaway, sir, that you have mentioned. when you have somebody who's holding your back, the journey becomes beautiful, and whatever hurdles and the problems that we face, of course somewhere our mentors are there to put hand on our shoulder and like कि, आगे बढ़ो, like this is how you can tackle it. And
Definitely.
with a passion and strategic approach, I think of course we can achieve greater heights. Now when we talk about networking, and as you mentioned, network is the net worth, right?
Is greater than net worth.
Yeah. Yes, very important. So sir, when we talk about networking, all the associations that you are part of, I think that plays very important role. So can you tell us more about FPME, like how the initiative has started and what is the vision that this association carries?
So you can say that something, challenges, when there are challenges, something good is going to happen that needs to be, taken care when you are in a entrepreneurship journey. So there was one challenge of track and trace in 2017-18 when, DGFT issued one circular that until unless there are no barcode pasted on the products, no export will be allowed. For more than 10 to 15 days, all export of pharma products were stopped in 2018 April. And that circular was, issued without taking industry and trade into confidence. So I was before that there was a GST implementation and everything was there. So I was working on Pharmexil. I was outspoken, and I was taking all issues at Pharmexil level. So Pharmexil, one of my Pharmexil colleague told me that there is this track and trace issue meeting in Delhi, and there are group from Mumbai. They are coming to Delhi, and you meet there and represent your issues. So, Mr. Kamlesh Shah, who is a 50 years veteran for pharma exports, Mr. Ashish Shah,
Yeah.
who is also 30-40 years old, experience of pharma exports, Yogesh Doshi, Mr. Abhay Shah. We all 4 or 5 together, we met in Delhi. I remember in July 2018, we sat at Haldiram's in Connaught Place. And then we said that let's make this a platform and let's give this as a group. We were a WhatsApp group.
Right.
Then we thought that let us make this a platform for merchant exporters, because what we understood when we were discussing with government authorities, they were discounting traders, merchant exporters in very bad way because there was no voice. So we felt that there is an urgent necessity of having a voice for merchant exporters. We came together, we formed that association. We made certain representation where track and trace is now not part of the export policy right now. Pharmexil played a major role in taking that away. We represented MSME ministry because earlier traders were not part of MSME. So now traders are now included as an MSME. So whatever MSME benefits are there that we are getting, right? We set up a advisory panel because like all small MSME entrepreneurs, when there are challenge, there are no right advisors, and people go to the certain people and then they say that yaar itna paisa leta hai, kitna paisa khata hai yaar. It's very, and they lose money and they don't get the work also. So we set up an advisory panel. So we have right advisors where we can, anyone can get the right advice, right? And now we are working on multiple issues where we are saying that rupee trade should be part of our policy, export
Okay.
policy. Then we are now taking up a larger challenge of because we don't want only to fight with the government. We
Yeah.
want to partner with government and facilitate exports.
True.
So we have made a proposal of having a logistic part, warehousing part dedicated for merchant exporters. We are advocating that MTT, merchandise trade transactions, which are happening, that is from one country to third country, that can be taken care. So all those things we are taking ahead. We are working closely on it, and hopefully we can grow large in numbers. Right now we are very limited in numbers, but in 7 years we have reached almost 500 people, exporters
Yes.
all over the India. But yeah, there are more than 2,000 exporters, merchant exporters, 3,000 exporters. So our vision is to get all merchant exporters on one platform.
Amazing, sir. Very amazing. So, sir, if you have to name one habit, right, for any growing leader or any entrepreneur or any business owner, that they should carry that one habit without, even if you are busy schedule, even if you are traveling, but one habit that they have to be persistent with, what it can be.
Habit, you can say, I mean, you need to be alert. Basically, that's the only thing. You need to be alert. You need to be updated with the happenings, current situations, what
Yes.
are happening, The small or big war, one small operation in Venezuela has changed the Venezuela
True.
market scenario for an exporter, right? This big war of Iran has changed this. So you need to be updated.
Okay.
So again, to get that updates and everything, as a busy schedule, you should be in the right network, right? So make a habit to get connected.
Yes, yes. Okay. And sir, when you said that we have to be keep updated with everything, and we have to keep networking. So I think Analytica Lab India and is a platform, and these are the exhibitions where you get to meet a lot of people. So what is your experience of being, on this platform?
Amazing. I mean, this is the first year, right? Here in Mumbai.
Yeah, it's been
Yeah,
like couple of years.
yeah.
Yeah, show has
So
been
I mean,
running.
Pharma Core is the first year,
Yes,
and
yes,
Analytical
yeah.
Lab is the couple of years experience. And amazing, the crowd here, the people here, and the session we had right now, and the presence there, the
Yes.
question and answer session. Really, I mean, people need such kind of platform, and Mumbai wanted one big pharma
Yeah.
event because CPHI went out of Mumbai,
Yeah.
and there was a void in Mumbai. So I would like to thank MMA to bring that back to Mumbai, and this is the amazing venue here in Geo
Yes.
Convention Center. I hope this will, fill the void what CPHI going to Delhi has created for Mumbai, and Mumbai requires, because
Yeah.
still Mumbai is the largest pharma export hub of India.
Yes.
So Mumbai requires such more, you know,
True.
I mean, to strengthen the pharma core and analytical lab India.
Yes. Yes.
So more and more people can come here.
Thank you so much, sir, for
Pleasure.
sharing your wisdom and taking your time.
Thank you.
I think like a lot of audience will definitely get benefit out of this. We have got lots of insights from this podcast. Thank you so much once again.
Pleasure.